Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Many things impact our overall health and well-being, but one very important area that is often overlooked is sleep. Did you know that losing even just 1 to 2 hours of sleep per night for several nights can impact your ability to function? Sleep can also impact appetite, mood, and much more. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Stay with us. We'll be right back. Welcome back. Today we are going to talk about the importance of sleep and sleep medicine. Joining us this morning is Dr. Diana Corzine with the Montana VA Sleep Medicine Center. Dr. Corzine is board certified in sleep medicine. Thanks for joining us today.
Absolutely, my pleasure.
So since we're talking about sleep, can we just start by talking about why sleep is so important to us?
Yeah, so healthy sleep is incredibly important, not only to feel good, but to have good health. Not having good sleep can lead to a number of different problems. Problems with high blood pressure, heart disease, memory problems, cognitive problems, depression, PTSD, which is something that we see in the VA quite a bit, as well as excessive daytime sleepiness or even drowsy driving. And in fact, there's evidence that increased motor vehicle accidents happen when we don't have good sleep, as well as there's recent studies that show that all-cause mortality, including cancers, some cancers have increased incidence in patients with not getting enough good sleep.
Oh, wow. Okay.
Yeah.
So how many people would you say actually have sleep disorders?
Oh, quite a bit. Sleep medicine is a relatively new sleep, a new specialty. It probably came to be more popular in the 90s and the 2000s, but probably over 80 different sleep disorders, and as well as 40 million Americans are estimated to be suffering from a sleep disorder.
Okay. And are there certain factors that can contribute to somebody's risk for getting a sleep disorder? Yeah,
absolutely. So different medical problems can add to sleep disorders, as well as psychiatric problems, environmental factors. And age is a big factor for sleep disorders, in that it's estimated that 50% of patients over the age of 65 have a sleep disorder. Obesity is also a risk factor for sleep disorders, particularly like obstructive sleep apnea, and it's estimated that people over the age of 50, 20 to 30% of men and 10 to 15% of females have obstructive sleep apnea. Other things like big life stressors certainly can add to insomnia, which can be acute or chronic, and such as a change in job, a death of a loved one, changes in work, but then also, as mentioned, depression, stress, or chronic pain can add to sleep disorders. There are also certain genetic factors that can lead to sleep disorders. In particular, one that people may or may not be aware of are things like narcolepsy, and also recent data that something called delayed sleep phase disorder may have a genetic component as well.
If I'm somebody who is having trouble sleeping, how do I know whether it's just that or if I actually have a sleep disorder?
I think that's a great question. And what I would say is there's two questions you should ask yourself. Number one, when you wake up in the morning, do you feel like your sleep was restorative and refreshing? And then the second question is, do you feel that you're rested throughout the day? Do you feel sleepy? And this is without any caffeine. If the answer to either of those questions is no, then you may have a sleep disorder. And while many of us occasionally experience problems sleeping for a variety of reasons, it is when these issues kind of occur on a regular basis and interfere with our daily function that there may be a sleep disorder. There's many, many different types of sleep disorders, as I mentioned, probably 80 different kinds of sleep disorders, and it can be from difficult difficult falling asleep or maintaining sleep or feeling extremely tired during the day. But they can also be a symptom of another medical or mental health problem. So it's really important to ask for help if you're suffering from problems sleeping or not feeling refreshed.
Okay. So you mentioned being sleepy during the day, not feeling refreshed. Are there other things I should be looking out for if I think I might have a sleep disorder?
Yeah, so difficulty falling asleep or staying asleep, having excessive daytime sleepiness or drowsy driving, having a strong urge to nap during the day or unintentional napping, irritability, anxiety, insomnia, lack of concentration, snoring, or if a bed partner notices that you stop breathing when you're sleeping at night.
So you mentioned seeking help. How would I go about doing that?
I think the first thing is perfect just to talk to your primary care provider. They should ask you more questions about your sleep, and they are going to look for other medical conditions that may be affecting your sleep, so they may do a physical exam as well. They'll want to hear about your symptoms and your medical history or medications you might be taking to help yourself with sleep, and they also may, after doing that assessment, refer you to a sleep medicine physician for a sort of further in-depth review of that.
Okay, and what kind of tests might get ordered for me?
So your primary care provider will want to make sure that your body is healthy, and so if you're feeling sleepy, they might order thyroid tests or other blood work, including a complete blood count. Make sure you don't have anemia. Check your electrolytes and your liver and kidney function. A sleep doctor will order most likely sleep testing. They're going to want to have some data. It's a little bit like if you give a carpenter a hammer, everything looks like a nail. But a sleep doctor will want to order some sleep testing. There's a number of different kinds of sleep testing. The most common tests one is called a home sleep apnea test, and it's to assess for sleep apnea. And another common test is something that we call an in-lab testing called polysomnography. The difference between a home test and an in-lab is that the home test, while it looks at oxygen, pulse, body position, and your breathing, the home test doesn't have leads that look at what stage of sleep you're in or what electrical activity in your brain you're in, whereas the in-lab polysomnogram will have that. The home test can be more convenient for patients at home, but there are certain patients that aren't good candidates for home testing, and so the sleep doctor will know which test is best for you.
Okay, perfect.
Yeah.
All right, thanks. We actually are needing to stop for a break here, but coming up next, just how much sleep do we need to maintain good health? We'll find out that and much more right after this. Stay with us. We'll be back after these messages.